This video related to essential science is going to begin Unit 2, Section 2, and we have completed Chapter 1, Chapter 2, Chapter 3. The platform for the remaining chapters is just a little bit different. So while we're going through Chapter 4, I will introduce you to some of those subtle differences. So let's go. Here's our book, and I'm going to get my glasses on so I can see. Okay. All right, let's go down through the table of contents and Chapter 1, Chapter 2, Chapter 3. And now we're into our section on systems of control. All right, so there are 3 chapters, just like in the first unit. Chapter 4, the one this video is about, gives you an overview of the entire nervous system, and then some more specific focus on the central nervous system. As I'd mentioned somewhere in previous videos, the foundation of massage benefit occurs through these systems of control and how they interface, and the series of cascading events with a stimulus response feedback platform is something to understand when we're thinking about what kind of outcome we want. So here's Chapter 4. As always, we start with our chapter outline. And then you'll see we get into some more specifics about what is a nerve and what is a nerve cell. And then this is one of the subtle differences. Now, at the end of the chapter, we are going to have our pathology section specifically. So last video, Chapter 3, and in Chapter 2, we talked about the process of homeostasis, and then what happens when homeostasis is not able to be maintained, and the importance of adaptability and resilience. And now, as we look at each individual body system, even though they all work together, as we look at them individually, we are now going to bring in a concise and relevant discussion about pathology related to that system. So as always, read your chapter objectives so that you know what's going on. Ask yourself how much of this you already understand. Some of you may even be taking a medication that affects the central nervous system, so you might have a real life understanding of some of this. You may already have an idea of the difference between a neuron, a sensory neuron, and a motor neuron. So here are your terms, and you want to be able, as always, to play around with pronouncing and to use these in conversation and see if you can embed them in a sentence where it is the understanding of the definition of the word is there. You learn these by using them. Learn how to learn. And again, it gives a suggestion on how to take this new information and transfer it into long-term memory and be able then to retrieve it. So that's a over and over and over repetition process. Repetition is not the same as memorization. So repetition is hearing it again, saying it again, writing it again, looking at it in a different platform. That's the accompanying videos that I post primarily from YouTube, that's part of their process. So the nervous system related videos that you will find in your monthly study schedule, it's part of that repetition. That's why it's important to listen to those. You don't have to memorize them, but there'll be 3 or 4 videos that are saying the same thing, but it's a different voice, it's a different platform. So it's that repetition, novel repetition over and over. The other thing that's helpful in chapters like this are examples and similes, or this is like that. So an example here is nerves are like electrical wiring in the house. So those are also learning strategies. And if you come up with a really good one, share it with your classmates. It doesn't matter if these stories or these similes or these metaphors are silly or not. Sometimes silly is and funny, as long as it's relevant and accurate, is a really good way to, again, encode this content. And then a reminder here, just because I post some relevant YouTube videos, you can also look for yourself. So, and you get on YouTube, you can put in the search term nervous system. And then I suggest you find videos that are related to grade school. And you can put in there as part of it educational videos for kids. These are really helpful. So this particular unit is going to build on itself, and it's a communication network. You can't really separate the functions. The nervous system stimulates the endocrine system. The endocrine system feeds into the autonomic nervous system. It's really an integrated, ongoing communication. There are chemicals. This is a chemical, primarily it's a chemical communication, but it is also the stimulus can be mechanical, like when we press on tissue or pull tissue, that starts the stimulation. These proprioceptors that we touch that are part of the nervous system are initially stimulated by this mechanistic stimulus, and then this mechanotransduction starts this chemical communication. And neurotransmitters are part of that language, as are hormones. So you got the drift now on how this is divided into sections that are about 15 to 30 minutes of reading, support that, study structure, give yourself a brain break, do the activities that are available. They don't have to be pretty. It's the doing of it and the thinking of it that is the learning strategy. So the beginning part of this is terminology, and the nervous system is sensing, interpreting, and acting. And that's where the communication comes in. We stimulate the sensing part. That's where we come in, and then the rest of it is processed internally. The nervous system is divided. There's the central nervous system, and that's where decisions are made, information is ultimately processed, and that's the brain, spinal cord, and their coverings. Where we have our stimulus effect is in the peripheral nervous system. And that is the cranial nerves, spinal nerves, ganglia, bunches of nerves together. And then that is divided, the peripheral nervous system is divided in the somatic, meaning body. That's what we touch. So our stimulus is part of the somatic. It's a somatic stimulus. But the context of the massage, the processing of that stimulus, the time frame, the rhythm, the ambiance of the environment, all of those things are also stimulus, and they interact with the autonomic division. So the things that clients see, the things that they smell, start to become part of the stimulus through the autonomic nervous system. So most, not all, but most of the benefit / results, mechanisms of action are going to process somewhere in this autonomic nervous system and its interaction between the endocrine system and the somatic nervous system, and then how the central nervous system processes all of that. So we have the autonomic nervous system divided into three parts. There is the sympathetic, which is where the fight, flight, fear, freeze, energy expending, vigilance, that's where that occurs. And then the parasympathetic, where we return from that vigilance to a non-alarm state, rest and restore, or rest and digest. Learning much more about the enteric nervous system, that's the gut, and the bacteria are, interestingly, are a major producer of the intestinal flora. They're a major producer of neurotransmitters and hormones. And so we have to stop and consider what's going on in the bionome in our gut and how that is interplaying with this. So always stop and pay a little attention to these focus on professionalism. And this is going to relate to what I just got done talking about. So nervous system anatomy, the actual structure of it, I've alluded to these. We've got afferent or sensory neurons that carry impulse. And then we've got connecting or associative interneurons, which, spread the message around. And then once a decision is made, either in the spinal cord or in the lower brainstem or up into the higher functioning areas of the brain, the message to respond, to restore homeostasis, is coming down the efferent or motor neurons. So A first, afferent, then it connects. So it follows the alphabet a little bit, A, C, E. And then the last part of the sequence is the efferent or the motor. This helps you review what you have learned, helps with you embedding this information. We're going to get down to the cellular structure now. And even though we don't directly touch a cell, we're more apt to touch a tissue or a tissue conglomerate, like the skin and the superficial fascia and all that, that's more, it functions as an organ, where there's nervous tissue and connective tissue and integumentary tissue, muscle tissue, all embedded together. But the nerve itself is what is listening and then carrying messages back and forth. So we sort of kind of need to know the language around this. And again, this here, this little professional application is massage therapists. When you give a massage, you communicate with sensory neurons. They are receptors. They're the listening stations, and then they send the message. So a neuron is a nerve cell, and they have parts. Dendrites are out and about, looking around for things and sending messages, and they connect and touch with each other. And the axon is the long wire, a bigger sense of a wire that the message runs along to get to where it wants to be, where it's interpreted. So you don't need to know, probably for the NBLEX exam, these specific ideas of a unipolar or a bipolar, but it's nice to have looked at it once or twice so that the information is stashed someplace in your brain. And then again, a reminder, the 3 functional classifications of neurons are sensory, interneurons, and motor. Afferent, connecting, efferent. Neuroglia is interesting. We're starting to get more information about neuroglia. It's kind of like the connective tissue-ish, glue-ish network meshing that nerve cells function around there. They can be part of what happens with a homeostasis breakdown and a pathology develops. They seem to be involved in various forms of dementia. They are involved in the healing of the nervous system. So it's again, while you probably won't be asked a question specifically about neuroglia on the NBLEX exam, it's because it is becoming to the forefront, just like the enteric part of the autonomic nervous system. For us to be excellent massage therapists and self-teachers, even though it's not on the licensing exam, for us to stay up to date with research and the implications for us as massage therapists, we need to have a base understanding here. So here's some little pictures of it. And the nervous system can repair itself. It takes a long time. And so most of the time, the scar tissue, connective tissue, non-functioning, but developing the integrity, holding things together, healing takes place before a actual nerve repair can occur. So that's something they're working with, for seeing if they can slow down that fibrous replacement with nervous system growth factors. And it's exciting, especially for nerve injury, spinal nerve cord injury, or a local nerve injury. And I think we're going to see more and more ability for nerves to repair themselves. And review what you've learned. So what do these nerves do, and how do they do it? So I already mentioned this a little bit. It's a stimulus that uses electricity and chemicals. So it's a really fascinating interplay with, you can kind of get a little intrigued about the electrical chemical aspect of human function when you look at how nerves actually receive, transmit, and then respond to information. So here is the general way that occurs. And again, you probably are not going to get a specific question about this on the NBLEX exam, but it's nice to know a little bit so you can just, your general reading through this and the review what you've learned and where you would encounter the information on an end of chapter question or at the end of the chapter here, or the chapter test that's on the Evolve site. Synapses and neurotransmitters now is where it gets really fun. And the communication, what transmitters tend to do and how they even move towards how we behave in certain circumstances. So you may get some questions about neurotransmitters related to massage, because as far as the nervous system is concerned, the autonomic nervous system interface and that overlap into the endocrine system, these are our communication chemicals. So I like to talk about the neurochemical soup and how our homeostasis is monitored by how that soup is seasoned. And so this particular practical application talks about that. This is a box on endocannabinoids, cannabinoids, and there is pretty good evidence starting to be collected that the pressure of massage and the shifting in the signaling when we do a more general massage, and it's pressure related. So we want to, be able to deliver a firm, pleasurable pressure to people. That the cannabinoids may be where that is affecting. And the nice thing about that is that nerve pain, neuropathic pain, neuritis, that's very hard to control. Opiates don't work on that very well, but the cannabis does. The chemicals in the cannabis and then our own internal cannabinoids, I can't say it. They are an exciting phase of us understanding how massage has benefit. And then what happens if these endogenous, made in the body substances, what happens when there's an external focus with that? Like if we are going to use a CBD product during massage, which is kind of common right now. So this is going to be an ongoing research, I think. So here's some studies here that you can take a look at. So here are the important, more common neurochemicals, and you're going to want to have a working knowledge of how these all work. And at some level, massage therapy interfaces with these various chemicals. So slow down and pay attention to this box. So this segment right here actually starts to make that connection between chemistry and behavior, body chemistry and behavior. So I take a Zoloft, a serotonin reuptake inhibitor, SSRI medication for obsessive compulsive disorder-ish tendencies. and makes my life a whole lot easier. And it interfaces within this chemical soup, this body chemistry. So it's not perfect, just like the thyroid hormone I take, which is an endocrine substance, is not perfect. It doesn't regulate like my body would do in maintaining homeostasis. But if my body can't do it, then I'm thankful that there is medication help with that. So by observing behavior, we can make some educated guesses. These are guesses, but it's kind of fun to do that. And so additionally, if the behavior somebody is doing is detrimental, we need to understand that whatever somebody's doing, they're trying to solve a problem. They're starting to work towards a solution, and the behavior that they repeat has been a solution. It may not be the best solution, but it has been one. So in order for a person to move away from a less than ideal activity, substance abuse is an example, or even over exercising as an example, they have to have something else that they can do, including a medication that can reduce the need to solve that problem. So back to my little tendency towards obsessive compulsive kinds of things, it would get so that I couldn't easily leave the house because I couldn't get out of my mind that I had left a burner on or the hair curler on, or and so it depleted me, it stressed me, and it made it very uncomfortable to go anywhere. And the medication helped me. I still have those thoughts, but the medication helps me not get fixated or stuck on that. I still do things. I still line things up in threes and that sort of thing, but it does make my life just as distressing and as anxiety producing as how I would feel if I didn't take the medication. So now massage also interfaces with serotonin. And for a little while after a massage, it's the pressure again. It's the pressure and the repetition. I'll sometimes act a little out of it, kind of like a glass of wine or something, because I've had the medication I take plus the influence of the massage on that neurotransmitter. They're synergistic, and it takes a little while for that to balance out. So a couple examples here. Substituting movement and aerobic exercise for binge eating may work because the two operate on a similar neurochemical. So eliminating binge eating without providing a substitute behavior leaves the person without the ability to achieve a sense of okayness. I'm okay. Chocolate is another one. These are food behaviors. Chocolate affects serotonin, as does carbohydrates and fats. These are feel-good neurotransmitters, and massage also stimulates those. But eating chocolate is faster and easier, and it's not as expensive. So, but eating chocolate and these other foods as the solution, and the only solution you've got to feeling better, can in the long term, in the short term it works, in the long term lead to additional problems. So slow down and read through this, and this is an example of how you can interpret this interplay between these neurochemicals, and then it asks you to come up with an example of how you had a chemical soup seasoning event. Also, primarily through the nervous system and the endocrine system, we have pain behavior and behavioral modifications. So this is the ongoing awareness of how our body creates pain, what is the advantage, when it becomes out of whack, and what we can do to work with appropriate pain, functional pain, productive pain, and then how we can change the neurochemical response around chronic pain. Okay, review what you have learned. And then we're going to get into primarily some anatomy here of the central nervous system. And so this is where you're going to want to narrow down. Again, not necessarily a full level of memorization, but certainly being able to recognize the terms when you read them, be able to understand what they're talking about enough so that you can go find additional information, and that your recall is at that functional level where if you see the word, you can maybe in the context of what's around it, interpret what's going on. So that's what this whole section is. And again, likely not to have a lot of questions on the MBLEX exam about frontal lobe, parietal lobe, but there might be something related to a person has had an injury that affected the temporal lobe. What might that affect? So here they are, in a chart form. And when somebody has had a stroke or a closed head injury, concussions, and an area of the brain here has been affected, it will manifest as a behavioral shift. So when I had the open heart surgery, I had some cognitive disruption, and I also had I still have a little bit of aphasia where I can't always easily get what's in my brain out of my mouth. And you'll notice it when I talk. So there was, they don't know why it happens. It could be little teeny tiny blood vessel occlusion, or it can be an inflammatory response related to the procedure of open heart surgery. But apparently my area right here in the premotor cortex, where there is something to do with my sequence and timing, or down further in where I have the area about language, maybe there's something that maybe happened there. And I had a personality change as well. I actually think I'm a nicer person now than I was before the heart surgery. And I can't totally explain that, but I think that some of it had to do with some actual tiny mini injury areas. And I ended up for the better, I think. So again, while we study these parts, we have to remember that they don't just all operate individually. It's a real communication network. And the integrative or associative brain functions, coalesce together to give us consciousness and language and emotion and our learning mechanisms as well. When you're listening to this and looking at the textbook, you are stimulating central nervous system function. The stimulus is visual and hearing in this instance. This is a fun little picture, sensory motor areas of the brain, and where the nervous system, or especially the brain, the sensory motor area. Remember, with massage, we are influencing the sensory area. How we where we might concentrate, where we would do massage, because there's actually more attention paid to these areas. So one of the things I tell people with massage is pay attention to hands and feet, head, and the face. Don't forget to massage those areas. There's a lot of sensory motor interaction here. So another box here on body chemistry and related behavior, and questions that we might want to ponder about what this is, especially if we're thinking about the potential for a referral. Is this a neurochemical imbalance? Is there an actual physical substrate here? And is that neurochemical imbalance what is causing the behavior? So it's a kind of a chicken or egg. Is the person trying to cope with something and that's causing the neurochemicals to shift? Or are the neurochemicals a little out of whack and that's influencing the behavior? Is the behavior somebody is displaying an attempt to regulate neurochemical imbalance? I explained that up there a little earlier with the food examples. Is the behavior a normal behavior but occurring at the wrong time? When we go through the course, you'll hear us repeat over and over the importance of regulation of breathing, and the breathing mechanism interfaces directly with the autonomic nervous system. And depending on the rate of our breath, and how that influences oxygen carbon dioxide balance, that'll influence whether or not we're more in a fight, flight, fear, freeze chemistry, or if we're more in a safety, relax, restore. So a lot of times we get into situations where we have a habitual breathing that is occurring, that is triggering a fight or flight response. And that's a normal response. It gets hard to diagnose because there is nothing wrong. It's just that this whole neurochemical response is being driven by dysregulated breathing, and then that changes the chemistry, and then we start looking around for what do I need to be vigilant about. And at its extreme, it can become a panic attack, and it affects all kinds of things like your digestive system and your heart rate. And again, if you go to try to find out what's wrong because you got a racing heart or your gut is all upset or whatever, they're probably not going to find anything. Previously, they would say, oh, it's just in your head or it's a stress response. Well, kind of, they're right. But it's also a neurochemical issue, and it is something that can be changed with a behavior modification, education, understanding what's going on with this breathing retraining. And it is an area that massage therapy can interface with, because when we massage the torso, we support uh, the mechanics of breathing, the bellows system of breathing. But then we also calm down. We help the person calm down. So that's an example of normal, but at the wrong time. And then, there are times when we need to be hyper vigilant and pay attention to what's going on, or times where we need to be uh, kind of distant and introspective. And there's nothing wrong. I know I have asked, and people have asked me, "Are you okay? Is something wrong?" And it is how I am, or anybody is coping, trying to restore a steady state here. And if you give them some time to do that, then they will, you will start to see that it is a self-regulation behavior and it's normal for the situation. Consciousness is an integrative function of being aware. And we have altered state of consciousness, and they're studying consciousness related to coma and life and all kinds of stuff, but it is very abstract. It starts to be where the mystery occurs, where we don't understand it all, but it's there and it makes a difference. So here's a box on consciousness and altered states of consciousness. Then we also talk about our language and emotions and memory, and the idea of state-dependent memory. If you are, let's say that you're studying the names of the nerves, and you are sitting outside on your porch, and there's a nice gentle breeze, and there's some flowers that smell real nice, and there's a tinkling sound off of a wind chime. All of that becomes part of your state-dependent memory related to the names of the nerves. That environment, a replication of that environment, actually will help you remember the nerves a little bit better. You'll recall, because it all comes together. So if you have studied in a relaxed state, that's where you're going to retain information the best. But then you go into an anxiety producing environment, test anxiety, it's going to be much harder to recall some of the stuff that you have memorized. Now, this does not mean that you want to study in a stressed state, because that doesn't work either. When you're in a stressed state, you're not working on long-term memory. You're working on survival skills. But learning how to downregulate and relax in an anxious situation will, as like when you're taking an exam, and you can practice that. You can practice your slower breathing and a mindset of confidence. Even if you're not getting the answer right, when you're doing the test questions, your chapter test questions, practice that idea of relaxation so that you can take that with you when you take the NBLEX exam. Slow down and pay attention to learning, because that's what you're doing right now, is learning. These other parts of the brain, they're more in the brain stem area, and hypothalamus is real important, because this is where the hypothalamus is where communication transfers. So nervous system information processed through the thalamus into the hypothalamus. Decisions are made about where to take the information next. Does it go to the endocrine system? Is it processed in as a reflex? So slow down, pay attention to the thalamus, hypothalamus, and then the pineal body, the pineal gland. Sometimes we've seen an overlap into the chakra system. The pineal gland sometimes is thought to be the third eye, but what it does is absolutely involved in the circadian rhythms that we talked about in chapter 2. So this little box, this practical application, talks about the importance of the pleasure centers and how the hypothalamus is part of that. And one of the benefits of massage is pleasurable touch. Not sexual touch, pleasure-based, satisfying, well-being touch. And our society is, we just don't have that. And that's why sometimes there is so much confusion around the touch systems like massage and how it might stimulate a sexual interpretation when it really isn't meant to be that. Just a fun note, that's Laura. You all know Laura. She's the one that collects all the payments and everything. That's a picture of her just before she went in the Army. She just got out of high school. So sleep is really, really important. This is where a lot of stuff gets cleaned up. The lymphatic system functions best. The brain is cleansed. Repair happens with growth hormone. And so one of the most important things massage can do is help people sleep better. Then we got the brain stem. These are areas of the brain that are involved in life-sustaining sorts of activities, like making sure you breathe and how your heart continue to function. And so if there has been a brain injury and somebody is in a coma, but they can still modulate or sustain a heart rate or that sort of thing, that's happening here in the brain stem. The reticular activating system is pretty interesting. It's what kind of stays on even when the rest of the body and brain kind of turns off during sleep. And that's why you'll be sleeping and then part of you, that little reticular activating system of you, is still awake, and you can hear, something something fall in the house, or if you're listening, you hear a baby cry, or you hear your teenager come in, even though they think they're sneaking in. That's happening here in this reticular activating system. And people that can't screen, they can't shut that down. It's a little bit a part of their understanding in the attentional I don't like to call them disorders, but attentional attention, ability to sustain attention, or you're easily distracted. And also on the autism spectrum, there's some interface here with the reticular activating system where they can't, that the way their brain functions, that it can't downregulate that a little bit. The vestibular apparatus is in our inner ear, and how it relates to the brain. And when it's actually a mechanical system. It's little tiny pebble-like structures in a fluid, kind of viscous fluid in the parts of the inner ear. And when I turn my head, those crystals float, kind of like a snow globe, float over, and then they land on little hairs that are attached to little nerves, and then that transmits positional information um, into the cerebellum and the central nervous system. And if that's out of whack, there is a condition called benign proximal vertigo, which I also happen to have. And the unusual, doesn't make any sense signals that come in when those crystals aren't the right spot, or they're not landing and stimulating the right sensation, will make you feel anxious and uncertain and out of balance and dizzy and nauseous and all of that. So uh, the vestibular apparatus is also connected with the eye function and the movement of the eyes and the tracking of the eyes. And so uh, subtle differences that happen in here in the interaction don't always are not easily diagnosed. And so a person can have some dysregulation in this area, and it would be attributed to something else. So a hesitancy for me to ride in the back seat, for example, because I would get car sick, would keep me from wanting to go out and ride with the family, but nobody ever knew why I didn't want to do that. And so, again, an example of how in that situation, an avoidance behavior may be indicative to something that's going on in part of these systems of control. All right, and then we have the various coverings of the brain, and we don't directly interface with these connective tissue coverings, but it's really good that we have them. And then there's, in between each of these coverings, there is a little space, and there's some fluid in there, or some connective tissue, or some fat, and it all ends up as a cushioning process for the brain, and also a fluid exchange place for the brain. And there is a system of body work called cranial sacral therapy that part of its theory base is that it interfaces with these meninges, and research hasn't necessarily shown that, but it's still, they're trying to find a biological plausible understanding for why their particular set of moves and philosophy is helpful. It's more like it's a slow, quiet, confident sort of touch with another quiet, caring individual is probably where most of the benefit is coming from. But who knows? Research may find that they actually are interfacing with the fluid in the central nervous system and these connective tissue coverings. So the ventricles in here is where that is also a fluid-filled structure that helps cleanse the nervous system's function. You know, anytime you expend energy to do something, there is leftovers, just like when you burn a piece of wood or a piece of paper, there is ash left over. That has to be cleaned out, cleansed out. And it also is a cushioning for the brain. So this is a very scrambled eggy kind of structure here in a connective tissue baggie with some fluid compartments that absorb movement in there inside a closed container. So if there is swelling or expansion in these fluid spaces, then it pushes the scrambled egg part out against that hard container of the skull. And that's not a good thing. So this area here is going to talk about the blood flow to the brain and knowing the location of how the vessels enter into the skull itself is important. They're back here on the back of the neck. And if we apply too sharp of a pressure and too long of a pressure in here, those vessels that enter into the circle of Willis, they're surface enough that we can crimp the tube and it can slow down blood flow to the brain. And if it's applied bilaterally, both sides, they'll talk about how when people are at a sink station where they put their head back to get their hair washed or whatever, the pressure right here at the back of the neck, it can be sufficient to slow down the blood flow to the brain, and a person can't get dizzy or they can even pass out. So this talks about that, the drainage and the fluid of the brain, and then what happens when it ages. You know, how does our how does our brain get old and how do we keep it sharp? And massage really plays into that because we help people manage stress, and we also can support regular physical activity. So, and most important, helping people sleep well. So out of the brain comes the spinal cord, comes out through a hole in the skull, comes down through the vertebrae that stack like Legos with little holes in them, so that when one Lego comes onto another one, when one vertebrae comes onto another one, there's a little hole that is created, and then the nerves exit through there, and then they are now in the peripheral nervous system rather than the central nervous system. So this language section is talking about the parts and how they're organized, and the importance of sensory ascending tracts. That's how the information from the peripheral nerves gets into the central nervous system, and then it goes up through the spinal cord. The sensory part comes up. And then the next part of that are the motor descending tracts. And there is some biological plausibility that during massage, as we stimulate a lot of sensation through these ascending tracts, there is a down regulation through the motor tracts, and that's how sometimes a sensation is inhibited, is so how that works through these sensory tracts and these motor tracts back and forth. So while we can't directly touch these parts of the anatomy, there is it's kind of like a two sides of a highway, one going north and the other one going south. And if we send lots of sensation in, it can push traffic also over to the other side, and then you've got stalled traffic and it can't get through. And then this fits into injury as well. Are motor neurons injured? Are they upper motor or lower motor neurons? What happens if it's the sensory tracts that are injured? So here's review what you've learned, and then we get into our pathology section. So here we're looking at a lot of the medication classes that interface, and you're going to want to have when you see these words, you are going to want to be able to determine what they sort of kind of do. It is likely that these words would show up on an NBLEX exam. Not the brand names, not the generic uh, names of it, but the classes of the medication. So analgesics work against pain, anti-anxiety work, obviously anti to reduce anxiety. And if it says anti here, it's trying to stop it or down regulate it. Then you have your sedatives and your antipsychotics. This is where your opiates live. So if somebody has got central nervous system related or nervous system related symptoms, these are the classes of medication. That talks about dependency and tolerance and all of that. So slow down and pay attention to these drug classes in here in this discussion. You're also going to want to be able to recognize these, for the most part, these pathologies. They are likely, they're common, and they're likely to show up on the NBLEX exam, asking you how you would recognize it, like a stroke, and refer or call 911 as part of a medical emergency, or how you would adapt to massage, or how you would support some other treatment. So again, this, you need to slow down on this, and then also pay attention to the indications and contraindications for massage. All right. Here's your review. And then, as you know, you have your chapter test that's got lots of questions on the Evolve site for you. You have your critical thinking, clinical reasoning activity here, and the author's response to this, along with your multiple choice question answers and rationale, are on the Evolve site for you. So I'm going to pause here for a minute. So on your Evolve site, here is your online course that accompanies Essential Science. It's orange. You've got the body as a whole, mechanisms of health and disease, medical terminology, and now you will work your way through Module 4, nervous system basics and the central nervous system. And then there is your exam. That's a 25 question exam, and that one needs to be completed so that it goes into the grade book. All right. Here we go. The nervous system and the endocrine system is, I think, is exciting. And like I say, the current research is showing that that's where massage interfaces. That's our place of interaction and communication with the body. So it behooves us to pay attention and again, get the concept, understand the theories, and where I've indicated, slow down and process more specifically the terminology. And then look at all of the YouTube videos I have posted for you, and look at other ones. Get together in study groups and do those end of chapter questions and work through the case study. Repetition, repetition, repetition. Novel, novel, novel. Retention, recall. Say it, talk it. Even if you I can't pronounce the word. You saw me do that with endocannabinoids. Oh, I think I said it right that time. But getting it in your brain and out of your brain is important for how you're going to create a pool of information that you draw on. not just for the NBLEX exam, but also for how you're going to ask pertinent questions and be able to research information, and how you're going to be able to interpret that information for an individual client, or how you're going to use that information to communicate with another health profession. So, ta-da, I like it. All right.